This video is going to be on the topic of mirtazapine. Just introduce myself, Dr. P. I'm a general practitioner in the state of Queensland, Australia. General practitioner is a family medical doctor. Mirtazapine, widely used, fairly modern, hasn't been out for that long. It's most of the new antidepressants are serotonin reuptake inhibitors, so they work on the serotonin system. The mirtazapine works on serotonin and noradrenaline, I think. May work on another part of the system as well, but it is different from most of the other SSRI medications. The other SSRIs being, Zoloft and Prozac and Cipramil and Lexapro and escitalopram and Prestique, and there's a million of them. Mirtazapine sort of stands a little bit alone. It has a couple of different side effects to most of the antidepressants, which can be useful and can be not useful. It tends to be sedating, so it's quite good for people who are depressed or anxious and who are having a lot of trouble sleeping. So it has quite a good sedative effect, and it's quite an effective sleeper. So that's the first thing about it. Can cause weight gain, not always, but it certainly can cause weight gain, and actually it's probably the commonest reason people give it up. But people who are depressed or anxious can often, be skinny and not eating properly, and not able to get their nutrition right, and cancer patients and whatnot with depression, they're always losing weight, and so a little bit of weight gain for some people, it's actually quite a useful side effect. So mirtazapine does cause weight gain, or can cause weight gain, not always. Comes in a dose of 15, 30 and 45. Comes in a tablet and a soluble tablet in Australia anyway. Most people start on the 15 and then go to the 30, and then if the 30 is not working, you can try the 45. Very effective. A lot of patients find it to be a very good antidepressant. It, like all antidepressants, can also have an effect on pain. If we were talking about mirtazapine in terms of addiction, it's not really addictive. None of the new antidepressants are really addictive. You can sort of become not dependent on them in the way that you would with a narcotic, with codeine or endone or morphine or any of those sort of things, or particularly the benzos, which are now a big no-no. But if you're used to something that's helping you sleep, and then you stop it, you might find you don't sleep as well, but you're not going to actually get physical cravings for it like you do for cigarettes or something like that if you've been on those for a long time. So yeah, very useful medication, used quite widely. There's a newer version of it, I think, which is called duloxetine, which in Australia is sold as Cymbalta, and I might do a talk on Cymbalta sometime, which seems to have quite a good effect on pain, Cymbalta. So that's the newer. I think it's the newer relative of mirtazapine. So that's mirtazapine, also sold as axit, is what we tend to sell it for, name it in Australia. Okay, so that's the story on that one. Thank you.